In few fields of human endeavor is the human touch so vitally important as in medicine. The successful clinician not only must understand how to bring science and technology to bear upon the problems of health, the successful clinician must also become thoroughly familiar with the techniques of dealing with a patient on a human level. Therefore, the successful clinician strives to be approachable, someone the patient respects and is able to confide in. This is important because successful relationships require collaboration. Therefore, the successful clinician must also be an empathic listener, able to put him or herself in the place of the patient and see things from the patient's perspective. An empathic listener understands that patients are unique individuals with unique health concerns. Get your patient's own stories in their own words. Use open-ended questions. Follow the patient's own cues and clues. And above all, listen. By truly listening to your patients and being open to both verbal and nonverbal communication, you can begin to comprehend their uniqueness and start the process of discovery that leads to effective clinical diagnosis and treatment. The successful clinician takes time for self-reflection so as to remain open to the possibility of his or her own biases. Through self-reflection, a clinician becomes aware of how one's personal viewpoint can be affected by a patient's age, social class, ethnicity, and state of health. Establishing relationships with individuals from a broad spectrum of backgrounds is an uncommon opportunity, a privilege, and a significant challenge as well. Therefore, we must look inward to clarify how our own expectations and reactions may affect what we hear and how we behave. The successful clinician is respectful and courteous. Having striven for self-awareness, the clinician is prepared to be not merely tolerant about individual differences, but respectful of them, which requires a higher degree of empathy altogether. In most cases, patients perceive you as a person of knowledge and authority. In that sense, you are your patient's host, and you should treat your guest with courtesy and with behavior that is professional. You demonstrate respect when you determine the personal space that will separate you from your patients, choosing an appropriate physical distance that promotes comfort while facilitating conversation and good eye contact. This personal space will vary in size depending on the cultural origins of your patients, and you show courtesy by acknowledging this difference and respecting it. You also demonstrate respect when you avoid arrangements that connote an inequality of power. Interviewing a female patient who is situated for a pelvic exam, for example, or seating a patient so they must face a bright light or window during an interview, are both examples of how to send a message of disrespect. The successful clinician is respectful and attempts to meet the high standards that patients expect. Professionalism means not only that one is knowledgeable, ethical, and dedicated, but also that one meets a high standard of appearance, grooming, and hygiene. The challenge, of course, is to meet these standards while remaining approachable, someone the patient is able to relate to on a human level. It all gets back to what I said in the beginning about how patients perceive us. The most effective relationships come about when the healthcare provider is neither placed on a pedestal nor regarded with suspicion.